We want to take a minute to thank our strategic partners as well as our sponsors who have helped promote the Caregiver Summit. Our strategic partners are the Alzheimer's Association of Eastern North Carolina and the Dementia Alliance of North Carolina, who both provide very important resources for those trying to navigate the complexities of dementia and Alzheimer's. We're also grateful to our sponsors for their financial contributions that make the Caregiver Summit possible. An extra special thank you to our gold sponsors, the Potter Financial Group, North Carolina Senior Medicare Patrol, and UnitedHealthcare. Because of them, there was no charge for you to participate today. Today, we'll be talking about Medicare versus Medicare Advantage plans, and we're honored to have two experts to help us understand more about this topic. They are Emily Whicheloe, Director of Education for the Medicare Rights Center, and Wanda Coley, Vice President of Strategy for UnitedHealthcare in North Carolina. First, I'd like to introduce you to Emily. I'm going to stop sharing my screen so she can work on loading her slides. Emily is the Director of Education at the Medicare Rights Center. She oversees the development of Medicare educational materials such as online trainings, handouts, and newsletters for consumers, caregivers, and professionals who serve them. She also provides Medicare counseling through Medicare Rights National Consumer Helpline, helping people with Medicare understand their benefits and troubleshoot solutions to their problems. Thank you so much, Emily, for joining us today. Uh-oh, I think you might be muted.
Oh, no. Yes, I'm unmuted. Great. Thank you. Oops. Oh my gosh. All right. Thank you so much to Transitions Life Care for having me here to present today. As mentioned, my name is Emily and I work at a nonprofit called the Medicare Rights Center. I will be providing an overview of different Medicare coverage options and a little bit about what you should consider when making coverage decisions, and then I will be turning it over to Wanda, who is our Medicare Advantage expert. So for a little bit of background on the Medicare Rights Center, we are a national nonprofit consumer service organization that works to ensure access to affordable healthcare for older adults and people with disabilities. We have sort of three main arms of our organization. One is our counseling and advocacy services. We run a consumer helpline that people call. We serve people throughout the country, and we also take on some people's issues as casework. We do educational programs like webinars or non-COVID times presentations in the community. And we also have a team out of DC that works to strengthen and protect the Medicare program through public policy initiatives. So today we'll be covering a couple of things. We'll start off with some Medicare basics, the types of services that Medicare covers. Then we'll move on to your Medicare coverage options. We have Original Medicare, Medicare Advantage plans, Medicare Part D, the prescription drug coverage, and then we'll talk about things to consider as you're making your coverage decisions. So first, for some Medicare basics. So for those who might be wondering, what is Medicare? It is a federal program that provides health insurance for people who are 65 and older, people who have been receiving Social Security disability insurance for usually around 2 years, and for those who are under 65 and have kidney failure requiring dialysis or transplant. Medicare sounds a lot like another federally run program, Medicaid. Whereas Medicaid is for people who have a limited income and assets. Medicare is for people, over 65 or people with disabilities. There's no income requirement. The names are very similar, very easy to get confused. So I just wanted to point that out because, we make that mistake all the time. There are two ways to receive your Medicare benefits, which we'll be going into in more detail later in the presentation. The first is Original Medicare, sometimes called Traditional Medicare. And this is the traditional program offered directly through the federal government. The other option, which around 1/3 or a little bit more of people with Medicare have Medicare Advantage plans. And these are private plans that contract with the federal government to provide Medicare benefits. So as you sort of start delving into the world of Medicare coverage, you'll hear a lot about these different parts of Medicare. And this is because the benefits are administered generally in three parts. We have Part A, which refers to your hospital or inpatient benefits. You have Part B, the doctor or outpatient benefits. And then Part D, like dog, the prescription drug benefit. So, original Medicare includes Part A and Part B. If you have, once you enroll in Medicare, you get a red, white, and blue Medicare card in the mail, and it will say Part A and Part B on it. If you decide to stay with that original Medicare coverage and you need prescription drugs, you'll have to get a separate private drug plan called a standalone prescription drug plan or standalone Part D plan to get that drug coverage. Now, you might be wondering what happened to Part C. We have A, B, and D. Part C refers to Medicare Advantage plans. Sometimes people call them Part C plans or MA plans. And again, these are the private health insurance plans that provide Medicare coverage. Some acronyms you might see associated with these or already be familiar with are things like HMO or PPO. When you have a Medicare Advantage plan, you generally get your hospital, your Part A, your outpatient, Part B, and your prescription drug coverage, Part D, through one private plan. And so that means that you'll have one card that you use when you go to the doctor or the pharmacy. It's all sort of rolled into one. As I mentioned, these Part C plans are administered by private insurance companies that contract with the federal government. So UnitedHealthcare, as you'll learn from Wanda, is an example of one of those insurance companies. And an important thing to note is that Medicare Advantage plans are not a separate benefit. You still have Medicare if you have a Medicare Advantage plan. It's just being administered or provided in a slightly different format. So that was a sort of high-level overview of the different types of Medicare. And now we'll talk about generally the sorts of services that Medicare covers. So first we'll talk about Part A, and again, that's the inpatient benefit. There's sort of four main types of services that Part A covers. One is inpatient hospital care, which is care that you receive when you're formally admitted to a hospital by a physician. A second type of care is inpatient skilled nursing facility, or SNF. Sometimes we pronounce it SNF care. And skilled nursing facility care is provided after you're in the hospital. It's a slightly lower level of care than you'd receive at the hospital, but it's usually if you needed to get rehabilitative therapy or you needed wound care, tube feedings. After a hospitalization, Medicare would cover that care in a skilled nursing facility. Medicare Part A also covers home health care, which are services provided at home if your doctor certifies that you are homebound and you need skilled nursing or therapy care. And then lastly, Part A pays for hospice care, which is comprehensive care for people who are terminally ill. We often talk about hospice care as being palliative care, so it aims to ease symptoms of a condition, but it's not services aimed at curing a condition. So Medicare covers palliative hospice care. On the other side of the spectrum, we have Part B, the outpatient coverage part of Medicare. So one of the main services that it covers is outpatient care, which is care provided to you by healthcare professionals if you were not formally admitted as a hospital inpatient. So sometimes you can go to the hospital just for like day surgery or it's not very intensive services, but you're still going to the hospital. You may not be formally admitted. If you're not formally admitted to the hospital, then Part B covers the cost of your care. Part B also covers doctor's services, which are medically necessary services provided by your doctor. It covers preventive care, which includes screenings, cancer screenings, mammograms, annual wellness visits to keep you healthy or to prevent illness. Part B also covers home health care. It sort of steps in if you don't meet the requirements for Part A to cover it. Part A requires a hospital stay before you can get home health care. but Part B will just cover your home health care if you meet the other requirements without a hospital stay. So again, home health care is services provided at home for people who are considered homebound. So it's very difficult for you to leave the home. We need a lot of assistance doing so. And you need some type of skilled nursing or skilled therapy care. Another main category of Part B coverage includes durable medical equipment, or DME. And this is things like wheelchairs, oxygen equipment, diabetes supplies, certain diabetes supplies, hospital beds, walkers, uh, equipment that can withstand repeated use and is mainly for use in your home. And while this slide only includes a sampling of the services that Medicare Part B covers, um, we chose these ones because they're sort of the main ones that come up on our helpline a lot, but just know that sort of any medically necessary outpatient services would likely be covered under Part B. Unfortunately, there are services that Medicare does not cover. I'm not going to go over all of these, but I do want to mention that some of the big ones that come up a lot are that original Medicare doesn't cover most dental care, most vision care, routine hearing care, but that some Medicare Advantage plans or Medicaid, if your income and assets qualify you in your state, may cover these services. And so as we're thinking about the differences between original Medicare and Medicare Advantage, one of the sort of main differences is that Medicare Advantage plans have flexibility to cover some of these excluded services like dental and vision, and many do provide some coverage for those. So we've talked about, in general, the services that Medicare covers. And so now we'll talk about how original Medicare differs from Medicare Advantage in more detail. So there's sort of four things that we can talk about as we're looking at original Medicare. The first, as we've already talked about, is that original Medicare includes your hospital insurance, your Part A, and your Part B medical insurance. To get drug coverage, you then purchase a standalone Part D prescription drug plan from a private insurance company. So you'll have your red, white, and blue card for your hospital and your outpatient services, and then you'll have your prescription drug card when you go to the pharmacy. And again, as just mentioned on the previous slide, original Medicare does not cover certain services, such as routine dental care. In thinking about provider access, one of the sort of big qualities that original Medicare has is that there's no network of providers. And so what that means is that as long as a provider accepts Medicare, you can receive care from any provider throughout the US. And I don't know if there's an exact percentage, but the majority of providers throughout the US do accept Medicare. So there's that sort of, if provider access is something that's important to you, then maybe that, makes original Medicare possibly a good choice for you. Another thing to know about original Medicare is that there's no referral requirement. So what that means is that if you want to go to a specialist, you can just go to that specialist. You don't have to see your primary care doctor first and get a referral in order for that visit to be covered. In terms of costs, original Medicare can be a little bit tricky in that regard for a couple of reasons. The first is that unlike private plans, original Medicare has no limit on out-of-pocket costs. However, for those who are interested or it works for their situation, you can purchase a Medigap policy that will cover your Medicare cost sharing. And so we'll talk a little bit about Medigaps on the next slide because we'll talk about Medigaps in a moment, not on the next slide. So I won't read through all of these costs, but for Medicare Part A, most people do not pay a premium, and we call that premium-free Part A. If you were a spouse, worked 10 years in the United States, paid Social Security taxes, Part A is free for you. There's a monthly premium for people, or who through they or their spouse don't have enough work history, but that doesn't affect as many people throughout the US. There is a deductible when you enter the hospital. And then the first 60 days costs $0 per day. And then if you're there for more than 60 days, you'll start paying a daily coinsurance. Similarly, for skilled nursing facility, that sort of post-hospital care that we talked about, the first 20 days, if you qualify for coverage, are covered at $0 per day. And then days 21 to 100 have a daily coinsurance. So these are not numbers you have to memorize, but it is good to know, sort of have in the back of your mind, if I go into the hospital, I'm going to owe, around $1,500 right off the bat for that deductible. And a deductible is the amount that you owe out of pocket before your insurance starts to kick in. For Part B, the costs are a little more straightforward. You have an annual deductible of $203. So at the beginning of the year, usually when you go to the doctor, you'll owe $203 out of pocket first until the coinsurance kicks in, where you pay 20% of the cost. And then everybody with Medicare, unless they qualify for an assistance program, usually pays the standard premium of $148.50. If you're collecting your retirement benefits already, this will be deducted each month. If you're not, or if you chose to be billed directly, then you'll be billed by Medicare and you'll pay that way. And there's just a note here that people with higher incomes pay more for the monthly premium. So for single people who make over $88,000 a year, and for couples who I believe make over around $176,000 per year, they pay a higher premium, but that doesn't affect as many people. Okay, so now it makes sense to talk about Medigaps. As I mentioned on the other slide, they are plans that pay part or all of the remaining costs after original Medicare pays first. So some of those things that we saw in the previous slides, the hospital deductible, the daily amount that you owe for days 61 to 90 when you're in the hospital. If you pay a monthly premium to purchase a private Medigap policy, you pay the monthly premium and then the policy pays for all or most of your out-of-pocket costs. They only work with original Medicare, so that's why we're talking about them in this section. And depending on how old you are, you might have 10 standardized plans to choose from, and they're named after letters, but as you can see, the alphabet doesn't continue because some have been discontinued after a while. One important thing to know is that if you turned 65 or you became eligible for Medicare after January 1st of 2020, you can't purchase Medigap Plan C or Plan F, but Plans D and G provide pretty comparable coverage. The only difference is that they don't pay for that Part B deductible, the $203. So again, Medigaps, they are provided by private insurance companies and they charge a monthly premium for coverage, and that premium can range, from $100, $200, $300 per month. But they can be a good option if you think they'll end up saving you money in the long run because your out-of-pocket costs would exceed that monthly premium. So here's just an overview of some of the benefits that all of the plans cover. So they pay for that coinsurance when you're in the hospital. They pay for the 20% that Part B charges, which can be hard to estimate. When you're going to the doctor, you don't know how much that 20% will be. They'll pay for the cost of blood, and they pay for the hospice care coinsurance. So I'll keep this slide up for just a moment because I really do want to call out a resource that you have for learning more about Medigaps in North Carolina. So there's a program called the North Carolina Seniors Health Insurance Information Program, or SHIP with 2 I's, for more information about Medigap enrollment. And the reason why I encourage people to call their SHIP if they have questions about Medigaps in North Carolina is because Medigap enrollment is generally restricted to certain times. One is when you first turn 65 and you enroll in Part B, and the other is when you lose certain types of other coverage. However, some states do extend the Medigap enrollment rights to maybe different times of the year or triggered by different events. And so if you're sort of past that initial time and you can get a Medigap, but you're interested in it, or you just want to know what your options are like in North Carolina, then this resource, the uh, Senior Health Insurance Information Program, is a really great place to call. They will be able to provide more information about Medigaps in North Carolina and help you navigate that enrollment. Okay, so we talked about Original Medicare with the Medigap add-on, and now we'll move on to Medicare Advantage plans. So similar to the things that we talked about with Original Medicare, we'll start with coverage. So as I mentioned, Medicare Advantage plans include Part A, B, and usually D benefits under one plan. And something that draws people to Medicare Advantage plans can be that they also can offer coverage for services that are typically excluded by Original Medicare, such as dental cleanings or vision. They might pay money towards your eyeglasses, things like that, gym membership. One thing to keep in mind with Medicare Advantage plans is that some of them may require that you see in-network providers in order to receive your care at the lowest cost. And so that's something to think about is, do my providers accept this plan that I want to enroll in? Some plans may require that a primary care doctor gives you a referral if you want to see a specialist. And then in terms of costs, Medicare Advantage plans do have an annual limit on out-of-pocket costs, which I'll go over on the next slide. But otherwise, the costs like premiums or deductibles or co-payments vary from plan to plan. So it's hard to make some sort of, sweeping statement about how much they'll cost. So generally, even if you have a Medicare Advantage plan, you're still paying that Part B premium to Medicare. And then your plan may charge an additional premium, but it also may not. If you're looking for a plan that doesn't charge an additional premium, usually they sort of call themselves like a $0 premium plan or something like that. And that just means that there's no charge on top of that $148. A plan may have a deductible, and plans generally have co-payments for, primary care doctor or specialist visit, but they may charge a coinsurance for certain services. And a coinsurance is a percentage, whereas a co-payment is a set amount. And, again, would like to bring up the point that you may pay more if you go outside of the plan's network or service area, or if you don't, follow the plan's coverage rules as they have them set out. So, as always, it's good to contact a plan directly if you have any questions about its coverage rules or what you need to do in order to get your services covered. I did just want to spend a moment talking about the maximum out-of-pocket limit, or Moop. This is a limit on your out-of-pocket costs under your plan. The maximum that it can be set at in 2021 is $7,550, but some plans may set it lower. The deductibles, coinsurance, co-payments that you pay for your outpatient and inpatient services help you reach your Moop. And then once or if you meet that $77,550 during the year, you owe no cost sharing for the rest of the year. And so depending on the services you're receiving or how much they cost, you may not end up meeting this maximum. But for people who need a lot of expensive healthcare, it can end up protecting you against higher out-of-pocket costs if you meet that limit. And then again, just a quick little table to show you the difference between in-network providers who contract with the plan to provide healthcare services and out-of-network providers who do not contract with the plan. So usually your costs will be lower if you go in-network. Some plans provide some coverage for out-of-network providers, meaning you don't pay 100%, but you'll likely pay a higher percentage of the cost. And then other plans just say, there's no out-of-network coverage, you owe 100% of the cost. So as you're looking for plans, that's something to keep in mind always is what does this provider network look like? Okay, moving on to Medicare Part D, the prescription drug benefit. Medicare Part D covers most outpatient prescription drugs, and one term that's really important to know with Part D is the term formulary, which is the list of drugs covered by the plan. And the reason why formulary is important is because when choosing a Part D plan, you want to make sure that the formulary includes the drugs you take. And as you may uh, be aware already, as mentioned earlier in this presentation, you can get your Part D through a standalone Part D plan that works with original Medicare or traditional Medicare, or it's usually included in your Medicare Advantage plan benefits. Again, there are, of course, costs associated with Part D. You'll owe a monthly premium. The average this year is around $33, but that can vary above or below that amount. A plan may have a deductible. The maximum it can be is $445 this year, but plans may set one that's lower. And then, as with Medicare Advantage plans, the coinsurance or copayment that you owe for your prescriptions will depend on the plan and the type of drug that you're taking. Uh, Something that Part D plans do is they structure their cost sharing. They structure how much the drugs cost in tiers. And so generally, this may be something that you're familiar with non-Medicare coverage as well, is the lower tiers are less expensive and the higher tiers are more expensive. And so a sample tiering structure could be that tier 1 are the generics, tier 2 are the preferred brand names that your plan, would like you to take. Tier 3 could be the more expensive brand name drugs. Tier 4 could be the specialty drugs. And again, this is just an example of how it may be structured, but just to give you a sense of the way the tiers work. And so when choosing a drug plan, you'll want to note if the drugs you take are on higher tiers. And if possible, find plans where the drugs you take are on lower tiers because that means they'll be less expensive. That's not always possible because some specialty drugs will always be in a higher tier and be more expensive. But for things like preferred brand names, those are going to vary between plans. And so that's something to look into as you're considering your prescription drug options. Another thing to think about with Part D plans, and to just three sort of terms to be aware of. One is prior authorization. And so when you're looking for a drug plan, if it says, this drug has prior authorization on it, that means you need to get approval from the plan before it will pay for the drug. And your doctor can help you get that prior authorization, but it's something to be mindful of if you think that would be a barrier to you accessing care. Maybe there's a plan that doesn't have prior authorization on the drug you take. A plan may also say that there's a quantity limit on your drug, which means that it restricts the amount of drug you can get per prescription fill. And this can also, be appealed, but it's something to be aware of. And then step therapy is when your plan requires you to try a cheaper version of the drug before it will cover the more expensive drug. And that just means that if you need to take the more expensive drug, you should work with your doctor to have them prove to the plan that the cheaper version won't work and the plan should cover the more expensive drug. Okay, so in this last section, I just wanted to provide a framework for thinking about how you can go about making decisions between these two options. So two factors to consider that come up a lot on our helpline that sort of guide people's decision making. One is provider choice. So as I mentioned with original Medicare, you can see any provider who accepts Medicare, whereas with Medicare Advantage, you usually have to see providers in the plan's network. However, something else to consider are the out-of-pocket costs. With original Medicare, you usually pay 20% of the cost of services, and you can purchase a Medigap policy to cover some or all of that cost sharing. But, as we talked about, Medigap enrollment can be limited or it may not work for everyone's financial situation. And on the other hand, you have Medicare Advantage, where you usually pay set co-payments and have a limit on out-of-pocket costs. And so, there's not one size fits all for everyone, and your coverage needs can change as time passes. So these are just two factors that we pulled out to highlight. Some questions that can guide your decision making. Do I travel often? As we talked about, Original Medicare works throughout the US. Medicare Advantage plans have networks usually. Another question to consider is what types of insurance do my providers accept? You want to make sure the providers accept the coverage that you're considering, because otherwise you'll have to pay for the full, usually pay for the full out-of-pocket cost. We want to avoid that. Some other questions to consider are what healthcare services do I need? As we talked about, Original Medicare doesn't cover things like routine dental care and hearing aids, but some Medicare Advantage plans will. Another question to consider is what would the costs be associated with this plan? So we, went over a lot of the different types of Medicare costs with Original Medicare and Medicare Advantage plans. And it, of course, can be very difficult to try and calculate these things, but thinking about, does a Medigap make more sense? Or does, the fixed copays of a Medicare Advantage plan make more sense? In terms of thinking about costs. So when you're choosing a Medicare Advantage plan, you'll want to keep in mind that no two plans are alike, and you should find out the plan's rules before enrolling. It'll be helpful to know if you need to see certain providers or get prior authorization for certain services. A couple of questions to consider. Which plans do my providers accept? Do I need a referral before seeing a specialist? Does the plan cover extra benefits? Do I want or need coverage for the extra benefits? And does the plan include prescription drug coverage? And does it cover my prescription drugs? When choosing a Part D plan, you'll want to consider, again, that no two plans are alike. You want to ask, are my needed drugs on the plan's formulary? Do any of my drugs have coverage restrictions? Are any of my drugs on higher tiers? And which pharmacies are in-network or preferred by the plan? If you use an in-network and preferred pharmacy, you'll usually get lower cost sharing. And you can learn which pharmacies are preferred by using the Medicare Plan Finder, which is on medicare.gov, or by contacting the plan. And then for my last slide, this is just a sort of visual representation of some of the main differences between Original Medicare and Medicare Advantage, which I can leave up for a moment as I pass it over to Wanda. Thank you.
Thank you so much, Emily. Darcy, do we have any questions from the audience?
We do have a question. Let me pull it up. What barriers or concerns might one encounter from changing from a Medicare Advantage plan back to Original Medicare? Or can this be done seamlessly with no issues in case of pre-existing conditions?
Thank you, Darcy. That is a great question. So according to federal law, and I don't know what it is specifically in North Carolina, if you drop your Original Medicare and your Medigap coverage, that's supplemental policy, and you go to Medicare Advantage, if you want to switch back to Original Medicare plus a Medigap later, years later, you might encounter some issues having coverage for your pre-existing conditions, or the plan may try and charge you a higher premium because you're not in a protected time to purchase that supplemental plan. And so that is sort of why I gave the contact information for that North Carolina agency, because they'll be able to let you know if you are thinking about changing, like, oh, these plans in North Carolina have lower premiums, or these plans don't impose a waiting period before covering your pre-existing conditions. So it can be done somewhat seamlessly each year, which Wanda's going to be talking about times when you can change your coverage. But the restriction on getting a Medigap at a good price may come into play, unfortunately.
That's great. Thank you, Emily. We've got a couple of more questions. I'm going to hold those to the end so we can be sure we get Wanda in, and I've got them right here. I'm saving them. Thank you.
Thank you so much, Darcy, and thank you, Emily, for the wonderful review. All right, I have Wanda's slides loaded. Can one of the presenters let me know that you can see them okay before I start her introduction?
Yes, I can see them.
Perfect. All right, so I'd like to take a minute to introduce our next presenter, Wanda Coley. Wanda is Vice President of Strategy for UnitedHealthcare of the Carolinas and Mid-Atlantic regions. In this role, Wanda is responsible for developing and executing market-specific strategy that prioritizes local initiatives in order to drive business growth. Other responsibilities include leading clinical innovation and fostering community partnerships. Wanda joined UnitedHealthcare in 2019 from WellCare Health in Wilmington, where she served almost 20 years in a variety of roles. In her most recent role as President and Chief Operating Officer, Wanda oversaw the enterprise's 13 regional offices across North and South Carolina, leading operations, directing strategic initiatives, and managing the executive team. Wanda earned a BS in accounting from the University of North Carolina at Wilmington and holds a master's in business administration from Webster University. As an active member of her personal and professional communities, she currently serves on the board of the YWCA of Lower Cape Fear, Wilma Advisory Board, and UNCW College of Health and Human Services Advisory Board. She is a past member of the National Association for Home Care and Hospice Financial Managers Advisory Board, the North Carolina Association for Home Care and Hospice Board and Enterprise Fleet Management Advisory Board. In her free time, Wanda likes to travel and spend time with her family. Thank you so much, Wanda, for joining us today.
Thank you for having me today. It's good to be here. As she said, I'm Wanda Coley, and Emily has done such a great job just talking about the differences between Medicare and Medicare Advantage. I do live here in North Carolina, so we'll talk about just kind of broadly Medicare Advantage in general. There may be some semblances to some of the things that Emily talked about, but I will do my best not to be redundant. Some of the questions that we will speak to are just some common questions in terms of Medicare and Medicare Advantage. You can advance to the next slide. I'll be sure to tell you that. Advance to the next slide. Thank you. So a few highlights that we will talk about today, just briefly, who can get Medicare, which she's done a great job covering already. Where can you get more coverage? When can you change your coverage? Different Medicare annual enrollment periods, how you can save money with Medicare Advantage. And I'll leave you with some resources that will provide a lot of information on this as well. Next slide, please. So Medicare is an individual insurance, and so such a great question. Who can get Medicare? And advance the slide, please. I'm sorry, I think we're one ahead. Yes, there we go. So as Emily said, there are eligibility requirements for Medicare. So just a quick review here. You have to be a US citizen and a legal resident. You have to have lived in the US for at least the previous 5 years. And you also must meet one of the following requirements: be age 65, younger than 65 with a qualifying disability, and have received disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. And each individual enrolled in Medicare gets a card with a unique number on it. And you can see here what a Medicare card looks like. The Medicare numbers are randomly generated and assigned. Next slide. So we often get the question, can you have Medicare and Medicaid at the same time? And the answer is yes. People who are dually eligible have both Medicare and Medicaid. If you have both, they work very well together and may cover costs, may cover all of your healthcare costs. Additionally, dual eligible individuals may be eligible for specific private Medicare plans. For example, people with Medicare and Medicaid can get a special coordinated care plan called a dual special needs plan. And UnitedHealthcare offers dual special needs plans that you can choose from to help fit your needs. Next slide, thank you. So now we're talking about where you can get more coverage. So original Medicare doesn't cover everything. Emily's talked about that. There are some out-of-pocket costs for healthcare items and services that can add up and really take a big bite out of your budget. The good news is that you have options for other coverage that can cover other key things like prescription drugs, and they help you better manage your overall healthcare costs. So now we're going to talk a little bit about Medicare Part C and Part D and how they may work when you're deciding on a Medicare Advantage plan to choose. So you can stay right there on that slide. Thank you. So Part C, Medicare Advantage. Part C is Medicare Advantage, and sometimes you hear Part C and sometimes you hear Medicare Advantage. They are one and the same. Medicare Advantage is an alternative to original Medicare, and it offers another way to get your Part A and Part B benefits plus more. Most plans also include other benefits like prescription drugs and several benefits like dental, vision, hearing that aren't included in Medicare. And we will talk quite a bit more about some other benefits that Medicare Advantage plans offer. And the good news too about Medicare Advantage is all your benefits are covered under one plan, which makes it a lot easier to help you manage your healthcare cost. Next slide, please. So Medicare Advantage plans must provide all the benefits that original Medicare does, right? So that means that these plans combine Part A and Part B coverage. Most Medicare Advantage plans also include built-in prescription drug coverage or Part D, which we'll talk about next. And finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, and hearing, as well as fitness and wellness programs. This results in all-in-one plan approach, similar to what you may be used to when having a health insurance through an employer. Thank you. So just some quick facts, some additional things to know about Part C. You must be enrolled in Part A and Part B to be eligible for a Medicare Advantage plan. You must also live in the plan service area. So for instance, if you're choosing, if there's a plan in North Carolina that you're interested in, you must live in North Carolina to be enrolled in that plan. I did see a question in the chat about being denied coverage. You cannot be denied coverage for Medicare Advantage plans. And importantly, unlike original Medicare, every Medicare Advantage plan has an annual out-of-pocket maximum, which is called the Moop that Emily mentioned earlier for Part A and Part B services. And once you pay this amount, the plan then covers the entire cost for services for the rest of the year. So this really does help you have an idea of what your maximum out-of-pocket costs will be for healthcare and helps you manage your budget. So now let's talk about Part D, prescription drug coverage. And an easy way to think about this is D stands for drugs. Remember, drugs are not covered by original Medicare except in select circumstances. You can get drug coverage in two ways, and you can see these here on the screen, through a standalone Part D plan or through a Medicare Advantage plan, as we just discussed. Standalone Part D plans can work with original Medicare, Medicare supplement insurance plans, and also Medicare Advantage plans. Like Medicare Advantage plans, Part D plans are offered by private insurance companies like UnitedHealthcare. Next slide. So just a few final points here on Part D, some fast facts. You are eligible to join a Part D plan once you are enrolled in Part A or Part B, or both. Plans often have pharmacy networks that you need to use to get the plan's pricing. So, it's important that if there's a pharmacy that you've used for a number of years and you really like going there, check to see if that pharmacy is in the plan's network. If not, you may choose to use a different pharmacy to make sure you get the best pricing. And plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. So it's important to make sure that you gather that information. And we'll talk a little bit too here about how to save money with pharmacy. So I'm sure just through the discussion today, you can see that Medicare is not a one-size-fits-all approach. At UnitedHealthcare, our goal is to help people live healthier lives. We strive to customize benefit plans to meet your needs. We have smart, affordable plan options that feature enhanced benefits, and some of them are here on the screen. I'm not going to talk about all of these, but I do want to highlight a few. And so as you look at this list, and thank you for advancing, as you look at this list, these are benefits that are offered by a lot of Medicare Advantage plans, including UnitedHealthcare, that are not included in traditional Medicare. So we've already talked about dental, so preventative dental care. UnitedHealthcare has one of the largest dental networks in the country. Vision is part of a Medicare Advantage plans with coverage with $0 eye exams, and there's also allowances for eyewear, including contact lens. Couple more that I'd like to hit on here is Renew Active is UnitedHealthcare's fitness program. And, you know, as I think about the pandemic and, you know, really we found different ways to exercise, like getting outside and not necessarily being able to go to the gym. Their Renew Active actually offers fitness programs online that you can access. And we also have participating gyms that are in our network, a vast amount of gyms that participate where you can go to the gym and it's covered. This is part of your plan, is a gym membership. So I think this is such a great benefit. And as people are vaccinated and start getting out more and want to become more active, this is such a great benefit to take advantage of. Preventative care is so important. Mammograms and colonoscopies are a $0 copay for UnitedHealthcare Medicare Advantage plans. And that's for both preventative and diagnostic exams. We've talked about hearing is covered. One other benefit that I think is great is virtual visits. So it simply allows you to have access to your physician from the comfort of your own home. The only thing that you need is a mobile phone, a tablet, or a computer. And you can actually have a physician visit for mental health or for a medical need and connect with the physician remotely. And last year, and I'll move to the next slide, is UnitedHealthcare has a national network. So if you are at home or if you're traveling, you pay in-network costs when you see any doctor in the UnitedHealthcare Medicare National Network. So what does that mean? If you live in North Carolina and you have a North Carolina plan, but you travel to Florida and you're on vacation and you have a healthcare event, as long as you see a physician in Florida that is in the UnitedHealthcare network, then you will pay in-network cost. So I think that's such a great advantage that you can leverage our Medicare National Network. And then House Calls is also a great program that we have where we have, it's an annual visit where we have one of our team members from our medical staff actually come to your home and do some assessments and ask questions, do a safety review of your home. It just, again, preventative ways to help keep you healthy. Okay, and you can stay right there. Thank you. So when can I change my coverage? We'll talk about that. There are several different periods when you can change your coverage. The first one we're going to talk about is the Medicare annual enrollment period. So the Medicare annual enrollment period runs from October 15th through December 7th. And when you choose your coverage during this period, your new coverage goes into effect on January 1. The changes that you can make during this time are listed here on the screen. We won't go into this deeply today, but the main message here is that Medicare provides this annual enrollment opportunity so you can keep your coverage up to date with your life and your medical needs. So as things change with you medically or you have life changes, then this is an opportunity during a period where you can make changes to your Medicare Advantage coverage. Okay, and so then we just talked about the annual enrollment period. These are important dates. So remember, annual enrollment period is October 15th through December 7th. The Medicare Advantage open enrollment period is from January 1st through March 31st. This is available to Medicare, all Medicare Advantage plan members only. During this time, you can make changes to your Medicare Advantage plan, so that, which simply means you can switch to a different Medicare Advantage plan. You can drop a plan and go back to original Medicare. If you return to original Medicare, you may also enroll in a Part D plan until March 31st. So you may also enroll in a Medicare supplement plan as well. So we've talked about the annual enrollment period is October 15th through December 7th, where you can choose a Medicare Advantage plan to participate in. And then if for some reason you want to make changes to that, you have the open enrollment period is from January 1st through March 31st to make changes. So then there's also a special enrollment period that's for qualifying life events. This is for those times when life doesn't happen on Medicare's schedule, so to speak. So certain situations such as moving to a new home or certain changes in your health status or healthcare coverage or just your overall health can qualify for a special enrollment period. In most cases, you have 2 months from the date of a qualifying event to make coverage changes. And during the special enrollment period, you may switch or drop a Medicare Advantage plan or prescription drug plan, but you can't switch from original Medicare to Medicare Advantage plan, okay? So we won't go into this too much, but the main point here is that Medicare provides for times when you might have to change your coverage outside of the usual fall annual enrollment period, which is from October 15th through December 7th. Next slide, thank you. All right, so we've talked about your Medicare coverage options. We've talked about the costs you may have, how to enroll, what are those different periods for enrollment and making changes. Now let's talk about just a couple ways on how to help you save money. Next slide, thank you. So it's important that when you enroll in any benefit plan or in Medicare Advantage plans that you use your benefits wisely. You want to make sure that you know what benefits are available to you, and then that you use those benefits to help keep you healthy, help you stay active. Using those preventative services that we talked about, like the $0 mammograms, colonoscopies, getting your vision and hearing exams. Those are all important. Use your plan's provider network. Again, when you're choosing a plan, you want to make sure that your physician or a hospital that you go to are part of the network, the plan's network. So that helps you pay in-network costs versus out-of-network costs, which are generally higher. Talk to your physician or your pharmacist about generic or low-tier prescription drugs, as Emily talked about earlier. Drugs, you often hear tiers. Medicare Advantage plans do have tiers, and the lower tiers are lower cost drugs. So if you're taking a drug that's on the higher tier, ask your pharmacist or your doctor if there's a generic or a drug that's on a lower tier to help you save money. Mail order is a great and convenient way to have your medications delivered to your home. You can have them delivered in 90-day supply, so you're not having to drive to the pharmacy every 30 days, run out of your medications or forget, but you can set your medications up on mail order pharmacy. Is such a great way to help stay compliant with your meds. And it's always important, if you're in the hospital, ask whether you're inpatient or if you're in observation, because this can make a difference in how your care is covered. And this may also have an impact on your cost. Next slide. So where can you go for help or more information? I'll leave you with a couple resources here. Visit MedicareMadeClear.com. There is a lot of information about Medicare and Medicare Advantage, about Medicare Made Cleared at MedicareMadeClear.com. A lot of the information we share today is there. There's a lot of great resources like on-demand videos. You can download different guides and more information. When you visit MedicaidMadeClear.com, it will prompt you to see if you want to join or sign up for our newsletter, and you'll get up-to-date articles delivered right into your email inbox. And then there's just more Medicare topics and articles on this site as well. You can follow us on Facebook to stay current with Medicare news, and also visit our YouTube page. There are a lot of great videos and resources on our YouTube page as well. Next slide. I'm almost there. So a few more resources. You can find helpful information at medicare.gov. This is the official government website for Medicare, or you can call Medicare at the number that's listed here on the screen. I think Emily talked about the State Health Insurance Assistance Program. That number is here where you can contact to see if you can qualify for financial assistance. You may also contact Social Security or your state Medicaid office to learn about other assistance programs. And this is the final slide that I have. So for more information on UnitedHealthcare Medicare Advantage plans, there's a lot of information at this link here, which is you can visit www.uhcnorthcarolina.com. It will provide you, just give you an overview of the different plans that we offer and other information about UnitedHealthcare. So thank you for your attention today.
Thank you so much, Wanda. That was a wonderful overview. Darcy, I think we have a couple questions that we have time for.
We do. And just a reminder that this recording will be uploaded to the caregiverssummit.org website later today, where you can get all of these contact pages, which are so helpful. Thank you, Emily and Wanda, for those helpful resources. Here's a question. If you still have insurance through your work at 65 years old and older, can you hold off signing up for Medicare, Medigap, and or Medicare Advantage plans?
I can take that real quick. I can't see if I can't really make eye contact with Wanda to see if she
That's
wants me to
okay.
answer.
You've got it, Emily. Thank you.
So the short answer is yes, you can delay Medicare enrollment when you're covered by insurance based on current work, but you'll really only want to delay that enrollment if the insurance is from a company with more than 20 employees. This is because when you have insurance from, they call it a larger employer like that, the employer insurance pays primary, and so you have primary insurance. You can get Medicare if you want it to be secondary, but you don't necessarily need it. If you have a small employer, 20 or fewer than 20 employees, Medicare should be your primary insurance. And so you should enroll in Medicare around the time that you turn 65 so that you can avoid, gaps in coverage or late enrollment penalties.
Great, thank you. If you have a Medicare Advantage plan, do you also need a supplemental plan?
I'll take that. If you have a Medicare Advantage plan, you don't necessarily need a supplemental plan. Your Medicare Advantage plan, as I talked about today, covers a lot of benefits that original Medicare does not cover.
Great, thank you. Let's see. Who is the decision maker? Let me read it the right way. Is the decision maker for whether or not something is covered and paid, is it the same for both the original Medicare and Medicare Advantage? If not, who would be the decision makers?
Well, I'll attempt this, Emily, but what's covered is determined by the plan, right? And so when you enroll in a Medicare Advantage plan, you will get coverage benefit, you would get information on all the benefits that are covered. So it should be very clear, but that's decided by the plan that you choose for Medicare Advantage.
I see Emily nodding. All right. Thank you both so much. Mary.
Yes, thank you again, Wanda and Emily, for this excellent review of Medicare and Medicare Advantage. This session was recorded and will be posted to the website later today. Thank you for joining us throughout this Caregiver Summit, and we look forward to seeing you again next time. Have a great day.
Thank you.